Zambia, a country in southern Africa, is a land of stunning natural beauty and rich cultural heritage. It is known for its breathtaking waterfalls like the majestic Victoria Falls and its amazing wildlife that roams freely in its vast savannas. The vibrant markets and the joyful laughter of children playing in the fields reflect a country full of life and energy. But amidst this beauty, there's a significant challenge that the people of Zambia face every day. Malaria, this deadly disease spread by mosquitoes, poses a serious threat to the health and well-being of the population. Malaria is a major public health issue causing illness and death, particularly among young children and pregnant women. However, Zambia has made significant strides in combating malaria, especially in the central province, through various initiatives and interventions. Despite these efforts, the fight against malaria is far from over, and the disease continues to affect many lives. Across the country, people in both rural and urban areas are at risk of contracting this preventable disease. Malaria places a heavy burden on families, healthcare systems, and the nation's overall development. But there is hope. The Zambian government and various organizations, such as the Church's Health Association of Zambia and Christian Women Rock, are committed to eradicating malaria. Christian Women Rock, a female-led organization visioned to uplift communities through empowerment and service, built on the principles of faith, compassion, and action. Christian Women Rock has spearheaded numerous initiatives to address community needs, offering a range of services from education to health advocacy. The organization continues to be a beacon of hope for many. With hard work, innovative strategies, and community involvement, a malaria-free Zambia is within reach. In partnership with the Church's Association of Zambia, Christian Women Rock was entrusted with a sub-grant from the Global Fund in collaboration with the Ministry of Health. This partnership aimed to advance Zambia's malaria elimination program, a cause that resonates deeply with Christian Women Rock's mission to foster healthier communities. The Malaria Elimination Program, running for 3 years, targets 6 districts in Zambia's central province: Ngabwe, Makushi, Serenje, Luano, Kapirimposhi, and Chitambo. Its objective is clear: to reduce malaria prevalence through targeted, community-driven interventions. And working together towards a healthier and brighter future for all. It's a story of unity, collaboration, and mutual support in overcoming a common challenge. Malaria is a big problem in Zambia. It affects countless lives every year, disrupting communities and causing widespread suffering. Just in 2022, there were over 8.4 million cases of malaria. That's a huge number. Imagine the strain on healthcare resources and the emotional toll on families. Sadly, 1,337 people died from malaria that year. Each death is a tragedy, leaving behind grieving families and communities. This shows how dangerous this preventable sickness is. It affects the most vulnerable, especially children and the elderly, and that is why Christian Women Rock has introduced innovative activities designed to engage communities and drive impactful change. The roadshows were a dynamic and interactive way to bring malaria awareness directly to the people. With lively performances and a catchy malaria prevention song, these events turned learning into a celebration. Community members were invited to participate in fun quizzes, answering questions about malaria causes, prevention, and symptoms. To encourage participation and ensure long-term impact, giveaways like End Malaria mosquito nets and branded bags were distributed, equipping families with the tools to protect themselves from this deadly disease. Christian Women Rock knows that community leaders are key to driving change. Through chief-led meetings, they collaborated with traditional leaders to take the message deeper into communities. These respected chiefs played a vital role in mobilizing their people, making the message of malaria elimination resonate across all districts. By engaging chiefs as champions of the program, Christian Women Rock ensured that prevention efforts were embraced by every household. Markets are the heartbeat of many communities, and Christian Women Rock brought the fight against malaria right to these lively spaces through market dramas. These captivating performances used humor and storytelling to convey important messages about mosquito control, proper net usage, and seeking treatment early. The dramas entertained and educated, leaving audiences both informed and inspired. The impact was undeniable as the crowds took home lessons that could save lives. Reaching every corner of the community meant going beyond face-to-face interactions. Christian Women Rock harnessed the power of media with their radio call-in programs, creating a platform for listeners to learn and engage. Partnering with local radio stations, they broadcast essential tips on malaria prevention, treatment, and symptoms. To ensure accessibility, the program aired in 3 local languages, making the message clear and relatable for everyone. Listeners gained valuable insights, with Christian Women Rock providing actionable advice to families eager to protect their loved ones.
My name is Musiku Bubala. I'm Malaria Elimination Officer at Ngawe District Health Office in Ngawe. Malaria in Ngawe has been alternating depending on the season. There are some times when we have higher malaria cases, especially during rain season in the fourth quarter of each year. But during the second quarter of each year, we usually record low cases of malaria. This has been attributed to the situation which is in Ngawe, where our district is surrounded with a lot of water bodies. Christian Women Rock has been in Ngawe for a year now, but they have a project of about 3 years in Ngawe. In the year that they have worked with Ngawe, in the Department of Health Promotion, they have done quite a number of things in order to change the behavior of the community in Ngawe district. One of the activities that they did, or some of the activities that they did in Ngawe, was to train 12 CBVs on social behavior change and data collection. When they trained these CBVs, they went into the villages to train other people in order to change the behavior towards their health. They are training other community members in order to own their health and able to prevent different kinds of diseases, especially malaria. The other interventions that Christian Women Rock are doing is they have trained about 10 CBVs that are engaged in the community in order to also enhance the social behavior change activities that are happening. They conduct health education. They also do several door-to-door activities in order to sensitize door-to-door or households about the effect of malaria, how to prevent malaria, and how to take care of the environment pertaining to eliminating malaria. So this is an organization that is coming with a lot of force in Ngawe and probing more about other interventions that can be done in order for malaria to be eliminated. Out of all the activities that the organization has put up in Ngawe, I can simply say we can measure some of the activities which they have done. One of the measurement I would take is when you ask a lot of community members about malaria, they are able to articulate how malaria comes about, how to prevent malaria, and this is because they have been educated by an organization. And one of the incidences that I would give is where the malaria cases have actually reduced. We are able to see in different facilities that malaria cases are reduced. This is because people have known what malaria is and have known how to prevent themselves from the malaria disease. Okay. Those are some of the impacts that I would mention that has come about due to the implementation of the programs by Christian Women Rock.
The next generation holds the power to shape a malaria-free future. That's why Christian Women Rock organize school debates, igniting young minds with knowledge and purpose. Through these debates, students explored the science behind malaria transmission, prevention strategies, and the importance of community action. The discussions not only educated the participants, but also inspired their peers to become advocates for change.
You can agree with me because some communities are not using clinical medicine, but they are using traditional medicine to cure malaria, which is not good because this traditional medicine have not a light dosage. I have evidence showing one of the traditional medicine. This medicine is used, they use chili, onion, and salt to make this medicine.
Inclusivity is at the heart of Christian Women Rock's approach. Through specialized meetings, they reached out to people with disabilities, ensuring this often overlooked group had the knowledge and resources to prevent malaria. These sessions were tailored to address unique challenges, offering practical tips and resources to empower individuals with disabilities in the fight against malaria. At the helm of this transformative initiative is the Executive Director of Christian Women Rock, whose vision and leadership have inspired change in countless communities.
Christian Women Rock is an organization that is registered under the NGO Act. We operate in the civil society space. We describe ourselves as advocates for disease prevention because of the programs we are into. Currently, we are implementing programs in malaria prevention, we are in sexual reproductive health, we are in cervical cancer prevention, gender-based violence, and also we deal with prison health, and also reaching the marginalized communities with different interventions that just prevent disease. We are also making sure that we engage with communities to make sure that diseases are prevented through social behavioral change. Usually that's the main strategy we use. We believe diseases can be prevented with treatment, of course, but behavior is the key. We can only prevent disease through behavioral change. Currently, we are implementing the sexual reproductive health project under PEPFAR in Luapula province, and then we have the malaria prevention in Central Province funded by CHAS, which is Churches Health Association of Zambia, and we have the cervical cancer that has also been implemented in Muchinga and Central Provinces. In Lusaka, we are so active into HIV prevention. We are members of the district HIV committees. We collaborate with menstrual health in all these activities that we are talking about. We have also been an active member in the civil society space, where currently we are coordinating the civil society self-coordinating mechanism, and Christian Women Rock, myself as an executive director, I'm chairing the civil society self-coordinating mechanism, which is a mechanism that has been able to respond to HIV, TB, malaria, and other pandemics in Zambia. And we are glad to report that so far we have done so much tremendous work. We in collaboration with Ministry of Health and also other stakeholders, including the National AIDS Council, the civil society, and also the private sector. In 2025, in the life of a project, the middle year is like the main year for implementation. So for 2025, in the malaria program, this is like the middle year because this is a 3-year program, and we intend to do more in the communities, especially building on what we have achieved already. This year, you will see us in the communities, focusing more on door-to-door because, like I explained, we use the social behavioral change model where we are targeting behaviors to change to prevent malaria. So communities need to be reached, households need to be reached, households need to receive the mosquito nets, need to use it properly, the indoor rescue spraying has to take place. Also, the prevention medication especially for pregnant mothers has to continue. And how do we do this? We need to continue engaging pregnant mothers. We need to continue engaging the communities through door-to-door. We need to go to the schools. We need to go in prisons. We need to focus on the key and vulnerable populations. For example, persons with disabilities. Many of the times they may be skipped with mosquito nets. They may not have an opportunity to listen to the radios, to the TV programs, even just on social media. So we are going for key and vulnerable populations to ensure that they receive the key messages in malaria prevention, but also in collaboration with MOH, make sure that people seek early treatment. And how do they seek early treatment? We are in the communities. With our community volunteers, we are able to identify people that are presenting themselves with symptoms and make sure that they access the medication very early. So apart from the usual market dramas that we're going to do, we're going to also go into schools. We need the pupils to start learning about malaria prevention strategies right from the young age, and we are going to schools. We won't leave out the churches, we won't leave out any other gathering. We are going to enhance in community dialogues because we need feedback also as an organization. What is it that is working for the community? What is making the community not to sleep under the mosquito nets? What is making the communities to opt for other herbal medicines than visiting the facilities? What is making the communities in Zambia not just to care about malaria? We need to have dialogues with the community so that we understand and we train each other, we teach each other, and that's the only way we are going to achieve it. So this year is very good, it's very busy, and we are going to continue making sure that we deliver these interventions to reduce malaria incidences in Central Province. Thank you.
Partnerships are vital in the fight against malaria. The Provincial Health Director has been a key ally in this journey, providing guidance, resources and support to ensure the program reaches every corner of the province.
Malaria Elimination Project by Christian Women Rock, which has significantly added value to Central Province in several ways. We have noted improved access to health care, which is one of the key benefits, with over 1.6 million people in Central Province reached with malaria prevention and control interventions, as well as information. The government, partnering with NGOs like Christian Women Rock, has trained and equipped around 2,500 community health workers to diagnose, treat and report malaria cases at the community level. Strengthened local health systems is another area where we have noted good partnership between the government and the Christian Women Rock. Over 1,500 neighborhood health work committees have also been trained on revised neighborhood health committees guidelines, enhancing their capacity to provide quality healthcare services. I expect Christian Women Rock to continue playing a vital role in malaria elimination efforts in Central Province. We also expect enhanced community engagement, which will likely be a key focus area with Christian Women Rock, working closely with the local communities to raise awareness about malaria prevention and treatment. Furthermore, innovative partnerships will be crucial in ensuring that the resources which are available are properly used. Overall, I expect Christian Women Rock to build on their existing efforts. What they've been doing, it has been positive. So we expect them to build on this and explore new and innovative approaches to accelerate the malaria elimination project in Central Province, while strengthening the collaboration with the government, private sector, and the local communities.
The success of the malaria elimination program is built on the power of partnerships. Christian Women Rock is proud to collaborate with the Ministry of Health, the Church's Health Association of Zambia, and countless other stakeholders. Together, these partnerships have amplified the reach and impact of the program, transforming communities one step at a time.
Wow, 2024 was very great, and 2025 we look forward to a more greater year, and it wouldn't be possible for the implementation that took place without the many stakeholders that we collaborated with. To begin with, we'd like to extend our appreciation for our sponsors, who is Church's Health Association of Zambia, in collaboration with Ministry of Health. They did a great job and they continue doing a great job. We also want to appreciate our board and management for Christian Women Rock. Without a stable board, we can't do the many things that we're doing in our communities. And also the churches, the private sector, the quasi-government institutions that we've been able to work with and collaborate with, End Malaria Council, National AIDS Council. We also want to appreciate our many communities that we have worked with, persons with disabilities. We have worked with different communities at any level in Central Province, and they've been able to cooperate with us. You can imagine holding road shows and people are welcoming you in their communities. They're able to listen to your message. We don't take this for granted, and we would like to see more of this even this year. Therefore, we want to extend our sincere appreciation even to Zambia Correctional Service. It's not easy to access, prisoners, but we have been able to be given the space to speak awareness messages to the prisoners, which hasn't been a very easy access, but we were able to be allowed to do this work. We want to appreciate all the stakeholders and the community-based volunteers who have been able to work with us. It is not easy to work in communities when it is rainy, when it is sunny, but these are foot soldiers in our country that have been able to reach the door-to-door households and other places with messages of malaria prevention. We sincerely thank you as an organization, and we pray that in 2025 we will work with you and cooperate with you more in everything that we will do. Thank you so much.
From the leadership of Christian Women Rock to the dedicated support of the Ministry of Health and Churches Health Association of Zambia, the dream of a malaria-free Zambia is within reach. Together we can eliminate malaria and create a healthier, stronger future for all.
Tuichingiride bose kubulwele bulwele nshubulole bwa malaria konseko waya bantu kututuma wai tatukonka fitu batweba bambi tulanda tawe fila fuluma no awelekeni tusanse keti tubike fya kufaya kumipa ya tufaya fya bonse tulendo mtende avoid kulalo kabula mosquito neti malaria ivi chabipa ile paya yena takwaba walisheta fire imweleteni tubike nemiti-shonza welekeni tufuse 17 shapa ma window closed avoid tukwingesha tu mosquito pasla un thing awateti mutu sake